Good afternoon, Mr. Joseph Pinto. Thanks for inviting me. My name is Dr. Ardiles Calle Juliet. It's a great pleasure and honor to be here. Today, I'll be talking about gender and outcomes in non-small cell lung cancer. And all prognosis variable comes back for the target therapy and immunotherapy. Introduction. Lung cancer is responsible for 1.6 million of deaths every year, where tobacco smoking is the main risk factor. While lung cancer has historically affected primarily men, the difference in the incidence of lung cancer between genders has narrowed over the last years. Differences are also observed in lung cancer susceptibility after tobacco smoke exposure. The difference in the clinical outcome between male and female patients with non-small cell lung cancer is well known and has been addressed, and several reports while women have a discrete risk to progression and death and even when adjusting for age, histology, and stage. Because the cancer corresponds to a heterogeneous entity, difference in the response to the treatment and outcomes could be related also to a differential distribution of clinical pathological features. For example, smoking status, histology, EGFR mutations, and some. In a previous work, we analyzed gender association difference in immune gene sets enrichment in NSCLC, where regardless of the smoking status on histology, women have hindered expression of gene states associated with immune processes. As gender influences innate and adaptive immune response, immunological difference could be behind the difference in outcomes observed in some malignant disease. Some therapeutic strategies involve manipulating the immune system, while the immune system per se helps to model cancer evolution, determining difference in tumor aggressiveness and response to treatment. In this paper, we'll explore gender difference in outcomes and treatment effects in the clinical trials, evaluating targeted therapy. Methods. Meta-analysis. For overall survival and progression-free survival, we extracted the logarithms of HRs and the SE of HR using to evaluate of HRs and 95% from the report on interest. A random effects model was chosen for the meta-analysis of comparison between gender because of the heterogeneity of period of time the treatment in the datasets. In contrast, we adopted fixed effects assumption for the evaluation of target therapy in clinical trials. Meta-analysis for gender difference in us. We retrieved information from 67 published records from the 1989 to 2016, of which 12 were eligible for data extraction. In total, only 7 referents were evaluable because they have data of HRs and 95% CA obtained from the multivariate analysis of us. One publication had HR data estimate in several periods of time. In the case, each period was included and a different group. Gender-specific benefits from target therapy and immunotherapy in terms of PFS. Meta-analysis of EGFR tyrosine kinase inhibitors. Meta-analysis of ALK inhibitors and meta-analysis of anti-PD-1 inhibitors. Results. In, pro- in total, 7 studies for us multivariate because analyses were identified because one study included 5 periods of time. Every period was evaluated independently. In the meta-analysis with the random effects method and HR 0.73 was obtained favoring female patients with a high statistical heterogeneity between cohorts, p 0.0005. Conclusion. Results of the or exploratory analysis suggest the need to reevaluate the influence of gender in the treatment effects in retrospective and in a prospective controlled fashion in subsequent clinical trials on the immunotherapy and targeted therapy. This is very important now that we are advocating for the personality and a cause effect medicine. Thank you.